Nursing is and always has been a career that has been very heavily advertised as feminine or a woman's job. This is the area of sexism that I believe is still overlooked today. While at first blush this seems to be a prejudice issue towards women, but upon deeper examination the rhetoric being told is extremely patronizing and degrading for all women and men. Nursing is not for the faint of heart. It is hard, physically and mentally. Hospitals would completely cease to run without them. Patient care would take an instant, steep decline without nurses, whether they are male or female. Going back through history, nursing has been seen as a feminine or female-only job since the 19th century. Within the 19th and 20th century, nursing became characterized as a woman's place. They were told to carry out doctor's orders, seen as less knowledgeable, good for cleaning up messes, seen as tender-hearted, and generally sexualized. While the man's place is to be the physician, to be the leader, the one who has all the answers, the one who never gets their hands dirty with their pristine white coats, and generally seen as cold and indifferent. Before that, a woman's place was only in the home, cooking and caring for her family. In ancient Rome, the religious orders, such as knights, hospitallers, during the Crusades, that did the work that nurses do today. However, this began to change with Florence Nightingale in the 1860s. She brought women in to fill the growing need within modern medicine. This idea carried over into the Victorian era, where nursing was one of the very few careers for women outside of the home and family. Nightingale not only helped fill the void that was currently in medicine, but also setting a standard of education and care that is still seen today. But she also cleared a path for women in a nursing career that was viewed as honorable. Nursing was no longer frowned upon in the upper class as her family had frowned upon her career choice. The need for nurses came to a head during the Civil War, 1861 to 1865. Men and women were both recruited to help care for the numerous injured. However, the women were nurses, while the men were considered orderlies. This set the stage for nursing schools to start. One of the first schools started in Pennsylvania at the Women's Hospital of Philadelphia. It was a 6-month-long program. Florence Nightingale helped propel forward the movement of nursing schools through Nightingale Schools. By the end of the 1900s, there were 400 to 800 nursing schools in the United States. These courses mostly consisted of hands-on learning with very little classroom setting. This movement continued on to the creation of Nursing Association and states starting to impose nursing licensing exams. By this point, the school had gone from 6 months to 2 to 3 years. However, sexism continued to set in, becoming more predominantly female as males were turned away at admission offices. This was quite the controversy, as recruitment ads for nursing at this time said that both men and women could apply, yet the schools were turning men away. This came to a head in 1981 when a case was brought before the Supreme Court that it was unconstitutional for nursing schools to be turning away applicants solely based upon them being male. While that case was won in the Supreme Court, sexism groundwork had been set for nurses to be female and doctors to be male in the medical field. Sadly, this is still largely seen today. Sexism is viewed as a problem that only affects women, but it's clear that it also extends to men. Men are still looked down upon for being nurses. It is viewed as the woman's job that emasculates a man who is working in that role. The nursing career path has a lot of stereotypes of what a nurse should look like. Many still view the nurse as a beautiful, dainty female with pristine white uniform dress with her hair up and a little hat perched on top, or as someone with cute little scrubs and clogs. However, nurses don't look like that. In fact, most do not. Male nurses face a lot of prejudices within these stereotypes. Many think that they're just in the profession to see women naked, or are the doctor, or that they failed at becoming the doctor. This may seem as nursing prejudice is only towards males. It's not. It's also so towards females. In fact, the whole medical field is extremely sexist. Males are looked down upon and emasculated for being a nurse, while females are patronized and undermined for being doctors. Female nurses have been over-sexualized and put down since the beginning of the field. It is seen as the woman's job to do the tasks of the men, or doctors, do not wish to do, tasks that are viewed beneath them. Women are seen as the kinder, gentler, weaker, and dimmer sex, who are meant only to clean and comfort, an extension of their work within a home, and that nursing was just another way to find a husband. Career recruitment advertisements for nursing have always been depicted a woman on the front. Class photos are still 95% female. Ad examples can be shown of this from the 1900s to today. They are heavily sexualized as well as primarily white. Out of multiple different vintage ads for nursing, only one mentioned that men could apply. One even said that it was overseen by men of long experience, while another stated the most attractive profession open to women only. Wording and depictions such as these help to continue allowing sexism to flourish. But it did not stop with recruitment ads. The sexualization of nurses was continued through cigarette ads that mention being ready to blow. It's also seen in cartoons that show men as the patients putting down nurses and viewing them as sexual objects with big slimy grins on their faces, or as his overseas mother. Nurses are not sexual objects or mother placeholders. All nurses are knowledgeable, professional, and frontline workers that save lives. Sadly, this isn't a problem that was just seen in the past, in vintage papers and ads. It's still seen today. Many advertisements show nurses as women. While different races have begun to be more inclusive, but the different sexes have not. At least 80% of all nursing ads depict a group of women. Nursing Appreciation Week is pictured as primarily women. The reverse is the same. Doctor ads typically depict males. One photo showed two little kids walking away from the camera down a hospital hallway. Should be cute, right? But on the back of their shirts, the little boy says doctor in training, while the little girl says nurse in training. It could be true. Maybe they do grow to be exactly as their shirt says, and that is 100% okay. The issue is that there is an underlying assumption that the boy will be the doctor and the girl the nurse. Back in 2017, the NHS hospital put out a nursing ad campaign that reached worldwide news within days of public release. These ads depicted beautiful, young, blonde female nurses with the captions that implied romantic and sexual meanings. One blog posted was titled 50 Shades of Hey by June Gervin, who stated, "Gender prejudices are alive and well in public images of nursing, and these prejudices are evident in the portrayals of nursing characterized as sexual playthings, beautiful, young, and sexy, defying danger to find romance." Nursing is not the first source of sexism that is typically thought about. It is one that is commonly brushed under the rug as it has been for centuries. The medical field is not one where what a person's sex should have any role or consideration to if a person is qualified for the job. Capabilities, knowledge, and compassion are the factors that should be taken into consideration. While this is a centuries-old idea, ads have continued to keep the rhetoric alive and thriving. If ads were not around to continue with this toxic sexist belief, then I do not believe we'd have segregated roles within the medical fields today.